Hi, I'm Selena Campbell, Director of Member Services for Progyny, a leading fertility benefits management company. Today, we're going to break down one of the most important steps in any fertility treatment experience, and that's the initial consultation. And we're going to do that with the help of an expert, Dr. Sheva Talebian, a reproductive endocrinologist from CCRM, New York. If you're in your journey, or maybe you're getting information for a friend, we ask that you subscribe to the channel. We're posting a lot of interviews with the nation's leading reproductive endocrinologists, and by subscribing, you'll help others to find this crucial information. When someone's been trying to conceive without results, the next step is to seek help from a reproductive endocrinologist, a fertility doctor. And the first thing the doctor is going to need to do is perform an initial consultation. It's best that you know what to expect at this first visit so you know what information will be asked of you. As Dr. Talebian is about to go over, the first step to the initial consultation is a conversation.
Basically, your first visit with a fertility specialist will mostly be a detailed discussion. And it should really be a two-way discussion between you and the physician. So I often start my consultations by just telling my patients, start from the beginning, tell me what's been going on, what brings you here, start from kind of the beginning of your journey, and then I'll delve a little deeper and ask about the medical history, the surgical history, detailed questions about their gynecologic history, family history, some important things that you can kind of gather some data ahead of time is asking your parents about, if you feel comfortable, asking them about their fertility history, asking your mother about her menopause history. If you have any siblings, getting some information from them can also be helpful because typically if you're seeing a fertility doctor because you've been struggling to get pregnant, we are I'm your detective, and it's trying to put together pieces of a puzzle to try to understand what is at the root of this.
So, the initial consultation is largely a conversation. It is a good idea to come to the conversation armed with some knowledge about your family history, if a parent or relative experienced any issues related to fertility. It's also great if you can bring any medical records, especially anything from any previous fertility-related medical issues. Fertility medicine is highly personalized, so the more information you can give your doctor about yourself, the better. But the initial consultation usually isn't the only conversation. There's also an exam, typically a pelvic sonogram and some blood work.
During the sonogram, we're really focusing on looking at the uterus, looking at the ovaries, just getting some understanding of your pelvic anatomy. You may also have some blood work done at your initial consultation, and the blood work typically that we do are some tests to understand your ovarian reserve.
Beyond the conversation and the standard blood work, there might be other tests ordered during the visit. This includes genetic screening, semen analysis, and a few other things depending on your situation.
Oftentimes we also offer genetic screening tests at your initial visit. This isn't often related to actually fertility, but if you are trying to conceive and your general doctor hasn't done any screening exams, we will speak to you about what genetic testing is, what we can offer. And again, these are looking for genetic diseases that you may be a carrier for. And then there's always some follow-up testing that may be ordered, for example, semen analysis, and so you'll meet with someone to discuss how that can get ordered. There may also be some follow-up anatomy testing that we offer, for example, something called an HSG or hysterosalpingogram, which is part of the basic fertility evaluation, and it's an anatomy check. It checks the uterus and the fallopian tubes. That also typically has to be scheduled at a certain point in the menstrual cycle, so you may meet with someone to talk about when that can be done. I do often kind of talk a little bit about treatment options at the initial consultation as well, because based on the history, you can sort of get a sense of what might be recommended. So you may talk to the doctor as well as about what the various treatment options are based on your history. But oftentimes the treatment plan is finalized after all of the testing is completed, and you'll do a follow-up discussion at that point.
The initial consultation is a crucial visit, and one purpose of the visit is for the doctor and staff to learn more about you and your situation. But don't forget that this is also a great opportunity for you to learn about the doctor and the team at the clinic. Depending on what treatments you might undergo, you may end up spending a lot of time with these people. So don't hesitate to start asking questions right away.
You know, so much about fertility treatment, I think, it's a journey, and you need a team behind you, and a team that you can trust, and a team you feel comfortable with. And so I think for you as the patient, that initial consultation is really important for you to assess your doctor and the team and the office staff. And is this a place that you're going to feel comfortable getting treatment at? You know, are they listening to you? Are they hearing you? Are they asking you questions? Are they letting you speak? I think all of that is really important. And you connect with the people there. And so I think, you know, as much as me as a doctor getting information from you, I also think it's important for you as the patient to kind of, you know, not interview your doctor and their team, but in a way it is an interview as well, and making sure it's a good match.
This is your health. You are the one in the driver's seat. The doctor and the entire care team at the clinic are there to help you reach your goals. And the initial consultation is your first opportunity to start creating a plan to move forward. Thanks for watching this video. If you like this video, feel free to share it with others or to subscribe. That will help others find it. And don't forget, if you want a ton more information about initial consultations or anything else fertility related, we have a wealth of knowledge for you at progyny.com/education. And if podcasts are your thing, check out This is Infertility.